Late Night Health continues. In a few minutes, we'll be spending some time with Todd Burnett. He's a retired Air Force, Army vet. He suffers from PTSD, 40-plus missions that were interrupted by bombs. We'll be finding out more about that and about a climb that's taking place as we speak to the top of Mount Everest, including one vet who is an amputee. He lost a leg. We'll find out more about that in about 10 minutes from now. We go back to the Washington, D.C. area, and we speak with our friend Mara Benner from Four Directions Wellness. What is the purpose of Four Directions Wellness, Mara?
So I just started Four Directions Wellness actually on April 1st of this year, and I am currently affiliated with the GW Center for Integrative Medicine, which again looks at whole person care. I'm so pleased. I'm in Alexandria, Virginia, and am so pleased to be working with them to provide more of the aspect of healing that is related to mindfulness and also to coaching with individuals. So Four Directions Wellness is all about connecting body, mind, emotions, and spirit. And I do that through offering Reiki, integrative reflexology, meditation and guided imagery, chakra healing, and also life and health coaching. And it's really an opportunity for me to be able to urge at least the D.C. area to adopt integrative healthcare. And I do that really also in four ways, and that's by individual sessions. It's also by classes, group sessions, because companies now are looking for the opportunity to have wellness provided for their employees, which is a whole new area that I think is fantastic to help and support employees as well. And then
a happy, healthy employee is more productive. Makes sense.
Absolutely, yes. And, you know, even the healthcare groups and the American Hospital Association in 2011 did a review of all the hospitals and found of those responding that 42% of them were adopting some sort of integrative healing modalities in order to not only help their patients, but also they were looking to ways to help their workers. The clinicians, the caregivers who are out there supporting all of the patients also need help and support. And so it's just another way of ensuring that there's help for those individuals too.
Is that including doctors?
Yeah, so when I'm working at the GW Center for Integrative Medicine, one of the things we do is we have medical students who are being trained and are going through a rotation sometimes on integrative healthcare. So there is this interest by physicians to understand whole person integrative care as well. And I think that's helpful. I was just at a national trade organization who said that originally they had maybe 3,000 physicians, and it was now up to 9,000 physicians who were really interested in understanding integrative healthcare.
Your background in policy, in management, is a little different direction. I know you should have called this 5 directions. Because the fifth direction is that you're now able to work one-on-one with people where you didn't get to do that as much. Am I correct?
Yeah, absolutely. You know, I started off my career working directly in nursing homes and loved working one-on-one with people. And then I kind of went into the policy work and didn't have a chance to work directly with folks and became, like many of us do, a family caregiver. So I was helping my mom through cancer and also my dad who was having some health issues. And, you know, it brought back to me how much being up on the opposite side of our healthcare system and not knowing how to navigate through it or what options you have, and really the fact that sometimes, even though all healthcare providers do their very best to provide the best care, we miss that whole person review. And for instance, my dad had depression that wasn't being recognized early on. It's really the fact that I've missed that opportunity to work one-on-one with people, and that all those experiences kind of led me back to saying I really want to get back into doing this, and am such a passionate believer that we've all got to look at how we can adopt whole person care.
Next time I'm in D.C., I want a reflexology session.
Great.
What about the what about the Marcus Welby? You know, the doctor who really, really cares. Do we have those anymore? And can Four Directions Wellness help us get that Marcus Welby back into our doctors' lives?
Yeah, and I think definitely right now we have physicians and other clinicians and caregivers who absolutely are very passionate about what they do and are very interested in making sure that the very best happens for the individual. The issue is that we're starting to recognize that there's so much more to this. The exploration now for healthcare is saying, wow, it's not just about that physical symptom, but rather it's really looking at the entirety of the person.
I cannot believe that we are just about out of time. Can you believe that? Will you come back?
Absolutely. I would love to.
All right. We will do that. We'll arrange that. Four Directions Wellness, if you're in that area. Real quick, what is your website?
It's www.4directionswellness.com.
4directionswellness.com. We'll have Mara back. Mara, thank you very much. I'm Mark Alyn. Coming up next, we're going to talk about PTSD. Don't go away. More coming up.